My name is Matthew Rutter. I'm a urologist at Graves Gilbert Clinic. I've been here for 12 years. So many people think urology is kidney stones or urinary incontinence, or maybe an older gentleman who can't urinate, but we are also the primary caregivers of all of the urinary cancers, in particular prostate cancer, bladder cancer, kidney cancer, and testicular cancer. And the evaluation and management starts with urology. In fact, in my practice, about 90% is prostate cancer or kidney cancer. Coming to Bowling Green for urinary malignancies is a prime place to be. We have all of the expertise and experience necessary to treat every urinary cancer, and we have the most state-of-the-art technology available right here in Bowling Green. There's really no reason to go to a larger city, and in fact, if you go to a larger city, you may actually have someone learning how to treat cancer working on you. We're here, we can more efficiently treat you with our own personal expertise that we've developed over many years. So we treat multiple different types of cancer, specifically kidney, bladder, prostate, testicular, and there are multiple different treatment avenues for each one of those cancers. One of the pieces of equipment that we use to treat our urinary cancers is the Da Vinci robot by Intuitive Surgical. What we have here is the 5th generation robot, which is the most advanced robotic technology available in the world, and we have several here in Bowling Green. We use this to treat patients laparoscopically rather than using open surgical techniques, which allows for faster recovery, less blood loss, and less pain. Using the robotic platform, patients will recover faster and have a lot less pain. They have a much shorter hospital stay when compared to open surgery. For instance, if I remove your prostate open, you might be in the hospital 2 or 3 days. With a robotic approach, you go home the very next morning. If I were to take your kidney out the old-fashioned way with a big incision, you might be in the hospital 3 to 5 days. With the robotic approach, you go home the very next morning. So an advantage for patients who have recently been diagnosed with prostate cancer or kidney cancer, or any urinary cancer for that matter, is the approach that we have as a group. Obviously, the physician takes the lead on the diagnosis and management, but we have a whole range of support staff, including nurse practitioners and medical assistants, who work directly with those patients to make them comfortable, feel more at ease, and bedside manner is most important when dealing with these sensitive subjects. We offer everything that a big city can offer a patient with respect to their urinary cancer, and we can do it better. Partly because we live in the community, partly because we care. They're not just another number, they're our friends. I don't have a lot of friends outside of work because I work so much, so I make my friends with my patients, and that goes a long way when someone has cancer.